My name is Dr. Carol Park. So I am a pediatric neurologist here at the University of Chicago. So I work for children and with families in terms of neurological disorders. So ranging from the brain, the spinal cord, peripheral nerves, all those things combined together. I wanted to become a physician, particularly because I wanted to help children recover and heal and essentially help them get better when they're sick. Even going to medical school, I thought I really wanted to do pediatrics because I had worked with children for many years before. And so I really enjoyed working with children and with their families together. And I think that's what really drew me to pediatrics, was just that it's not only just the child that I'm caring for, it's families and other doctors who are involved in their care. It's school teachers and therapists, sort of the big picture. And so I really like that, and working with families together and seeing children grow over time too, and how they essentially grow up and develop. My interest specifically within pediatric neurology is neurocritical care, and so that means medical care within the intensive care units. And so I particularly enjoy helping children recover. And it's a long process when kids are very critically ill in the intensive care units. And so taking care of them in the intensive care units, and then they go to the hospital wards and then home. So my interest is particular neurologic outcomes through all that process, because it's a lot of unknowns about that right now that we're still trying to figure out how to best provide care for our kids so that long term, after these really critical times when they're very ill, how do we help them to recover to their best capability and as much as we can? And it can be neurologic disorders, so things such as strokes, brain bleeds, traumatic brain injuries, but also other systemic conditions like heart diseases and infectious diseases all have neurologic complications from that. And so that is my particular interest, and I feel that it's a very special privilege to work with families throughout the whole process and help their children recover from critical illnesses. And so that's one of my particular interests in this field. I chose to come to Comer Children's because I was actually a resident physician here. So I did training here and really enjoyed my time here because we have world-renowned leaders in our fields, and in particular neurology here is very strong. And I really enjoyed the collegiality of the people here, and also I feel like that the patients here we serve are very special, and we have a huge population base in Chicago area that is in great need of medical care. And so I really wanted to at least be able to be a part of that in the Chicago area. But we also take care of children who come from abroad and from other places too. So we get both local and global experience here, and being able to do that is really special.